In prison, inmates are far from their former friends and family, and have to deal with the constraints imposed by the environment, which prevents them from having a normal work or study experience. Within the walls of the cell, time can be an adversary. Many inmates suffer the effects of negative psychological problems that are difficult to get out of for a long time. Psychologists are trained to help inmates manage negative emotions. However, the scarcity of these professionals paints a different picture. Despite the high demand of a psychological service in the prisons, there are simply not enough psychologists available. The result? Prisoners often remain trapped in a cycle of unsolved issues. The shortage of a psychologist in prisons means that inmates lack method to timely detect these psychological issues, which, by the time they are identified, have often become serious. This exacerbates the already limited resources for mental health support. So, what can be done in this situation? Could we empower prisoners to self-identify and address psychological issues through game-based methods? Introducing MindNote, my innovative product. Let's start with the record board section. The mood board, the first component of the record board, allows inmates to chart their weekly emotions by sliding a marker. The second section is the events board, which allows you to record what you did that day and it corresponds to your moods. Challenging days, inmates can grab a mood card from an activity section, jot down distracting thoughts, and hand it up. For positive days, they can note down uplifting experiences on the gratitude board, and regardless of mood, they can pick an affirmation card from the nearby box. Now, let's talk about the board game aspect. It's a cooperative game where inmates role-play as psychologists. Each player starts with 3 cards. Every card describes a symptom of a cognitive distortion that needs to be identified and documented. Players then use the answer board to verify each other's insights. Correct response earn stars. Once both players have successfully cleared the patient card that came with the board game, they can move on to the next level, trying to challenge themselves with their fellow inmates' negative cards. Now, let's look at the product usage scenarios. Both the mood board and events boards are waterproof, suitable for the shower cell. The activity and gratitude board, however, should be located outside the shower room, either on a partition side or suspended from a table. Thanks for your listening, and feel free to ask me any questions.